Hello, everyone, and welcome to this learning event, the SVRI learning event on priorities in child sexual abuse research in lower and middle income countries. We are going to be beginning in just 1 minute. Thank you so much, everyone, for being here with us. Yeah, and please feel free to introduce yourselves in the chat box, and yeah, welcome. All right, so since we're already a few minutes into the session, I'm actually, I'm going to start us off right now. Just to begin and give us an introduction to the context of the session and to SVRI, I'm going to hand over to Anique. So Anique, over to you.
Thank you so much, Aisha. Hi, everyone. It's really great to have you here in our learning event today. My name is Anique, and I'm a technical specialist for SVRI. And together with Aisha and Nicole, we're representing the SVRI team. And our small team are specifically focusing on exploring whether and how SVRI could strengthen our work on violence against children and child sexual abuse in particular. So for those of you who are new to the SVRI, I'll give a quick introduction. SVRI is the world's largest network of multiple stakeholders working to address violence against women and or violence against children around the globe. We contribute to these fields through activities within our 4 strategic goals, which are building evidence, strengthening capacities, promoting partnerships, and influencing change. Child sexual abuse has been a priority in our work since 2006. And through all of our work, we are dedicated to supporting and amplifying research from low and middle income countries. And today's learning event brings these commitments together as we focus on how we can drive forward ethical and impactful research on child sexual abuse in low and middle income countries. It's really exciting that 3 of our panelists today are recipients of an SVRI research grant, and we've been so inspired by their work on this very sensitive and largely under-researched area. I'm really excited to learn and then discuss the issues that this field is facing. But before we jump in, I do want to take a moment to acknowledge how triggering this topic can be, and I want to encourage you to practice care, kindness, and gentleness if you feel yourself struggling. Please do seek support so that you don't have to bear this trauma alone. And I want to say a special thanks to Aisha for doing all of the organizing and production for this learning event. Thank you so much, and back to you.
Great. Thank you so much, Anique. Okay, so just very quickly before we fully begin, as you know, we have tried to make this event a bilingual event where 2 of our presenters will actually be presenting in Spanish. In order to enable translation into English or any other language that you choose, there are 15 different languages that you can choose on the app that we are working with. You will need to just go through a small series of steps. And if you can just bear with me for 1 minute, I will launch this app now on our system. And then in about 30 seconds, I'll explain to you the steps that you need to go through, and I will post the instructions in the chat box. And so depending on whether, so the next 2 presentations will be in Spanish, depending on whether you want your presentation to be in, your translation to be in English or in any other language, you will choose the language that you require. All right, so I'm posting the instructions into the chat box, and I will also explain the instructions to everyone. So please look at the top left-hand corner of your screen where you should see something that says live on custom live streaming device. If you click on this, you'll see 3 options: stop live stream, view stream on custom live streaming service, or copy streaming link. Please click on the view stream on custom live streaming service. Once you do this, you will see when you reduce your Zoom screen that another browser opens. This is the Wordly app browser. It should be a small white box that opens. What we encourage you to do is you choose your language, but then reduce this. Reduce this box so that you can actually look at the Zoom screen and have your translation box alongside if you so desire. Of course, if that doesn't suit you, don't worry about doing that. At this point, you should have a transcribed stream of translation into the language of your choice. So I'm just going to wait a few seconds for everyone to do that, select their language and reduce the translation. And let's hope that that is working for everyone. Okay, and I am going to now hand over to our first speaker, and our first speaker is Nicole, and she will be actually talking about key findings from a scoping review on child sexual abuse research in lower and middle income countries that she has recently completed. So over to you, Nicole, and do let us know in the chat box if there are issues with the translation.
Buenos días todos. Nomás quiero. Sí, everyone can see my screen. Yeah?
Yes.
Okay. Buenos días, me llamo Nicole González, soy asistente de investigación con SBRI y como ya ha dicho Aisha y Anik, voy a hablar sobre una revisión del alcance de la investigación del abuso sexual infantil en países de ingresos bajos y medianos. Anik ya dio un poco de contexto sobre SBRI, pero nomás para explicar antes de empezar con la presentación del reviso, SBRI ha estado involucrado en la violencia contra los niños, el abuso sexual infantil desde el 2006 y también ha estado involucrado con la violencia contra las mujeres más tiempo que eso.
Nicole, I'm so sorry to interrupt you. I'm so sorry to interrupt you. I don't think the translation is actually working from the Spanish to the English. We're getting a very garbled and strange set of sentences.
Okay.
Okay, so I'm so sorry to do this, and I apologize to everyone. But can we go to Plan B, where you just give us a quick translation of what you're saying in Spanish? First slide.
Okay. Han salido nuevas intersecciones en la investigación de violencia contra los niños y violencia contra las mujeres y puede ser un tiempo adecuado para unir los campos. What I'm saying is that SBRI has been involved with violence against children, child sexual abuse and violence against women, and recent research has come about that has shown intersections between these fields that could be a really great time for the fields to unite. Anik ha dicho algunas cosas de que esto puede ser medio difícil, ya que hay tensiones y políticas entre los campos, pero es algo que se debe de reconocer, ya que queremos apoyar más bien a las poblaciones vulnerables. Anik talked a little bit about how there are tensions in politics between these fields, but we think that it's really important to recognize that it could be a great time for these fields to work together so that we can better support these populations that are vulnerable. Entonces, para poder contribuir estratégicamente y hacer acción basada en evidencia, realizamos una revisión del alcance de la investigación sobre abuso sexual infantil en países de ingresos bajos y medianos en los últimos 10 años. Decidimos trabajar en solamente países de ingresos bajos y medianos porque en eso se basa SBRI y en los últimos 10 años porque como es un campo nuevo, y se va avanzando con el tiempo, no podemos utilizar investigaciones antes de eso. So we decided to do a scoping review on research on child sexual abuse in low and middle income countries. In the last 10 years, we chose low and middle income countries because that is what SVRI works on, is focused on, and supports. And in the last 10 years, because this field is continuously changing, and so before 10 years would not really work for us. Okay. Entonces, a seguir con los métodos. Aquí se presenta el criterio de inclusión y de exclusión. Como ya he dicho, pues incluimos artículos que se publicaron en los últimos 10 años. Escogimos incluir unos que están en inglés, español, francés, árabe. Y pues claro que queríamos que estuvieran centrados en abuso sexual infantil, más bien que la población de interés en los estudios habían pasado por violencia sexual durante la infancia, y como ya había dicho, pues limitado a países de ingreso mediano y bajo. The inclusion criteria is, like I had just said, we included it in the last 10 years. We chose to do articles in English, Spanish, French, and Arabic. And of course, we wanted it to be focused on child sexual abuse, or that the population experience sexual abuse during childhood. And how I had just said, we focused only on countries of low and middle income countries. El criterio de exclusión es casi completamente lo opuesto. Nomás sí les quiero comentar que la literatura que sí incluía abuso sexual infantil y lo agrupó ese tipo de violencia con otros tipos de violencia contra los niños sin separar los datos, no los incluimos. So the exclusion criteria is basically the exact opposite. The only thing that I will mention is that literature that included child sexual abuse in group with other types of violence against children without separating the information, we were not included in this scoping review. Entonces, para empezar, encontramos 635 artículos. Hicimos un filtro de los títulos que resultaron en 252 artículos. Ya después de eso hicimos un filtro de los resúmenes que salieron con 197 artículos, y esos son los que se quedaron en el reviso del alcance. So we ended up with 635 articles. We filtered through the titles and ended up with 252. And then we did a filter of the abstracts and included 197 into the scoping review. La mayoría de los motivos de exclusión por los artículos que no se quedaron en la revisión del alcance son porque los datos no fueron desagregados. Sería en artículos que era que se enfocaban en mujeres y niñas, pero no separaban la información entre las mujeres y niñas, o también que la investigación fue en países de ingreso alto. So the majority of the articles that were not included were because the information was not separated between groups. Some articles included women and girls that experienced sexual violence, but the information was not disaggregated, as well as there was research from and in countries of higher income. Hice un análisis de en qué se enfocaban los temas de estos artículos, y al rato también voy a enseñar el análisis de dónde salían estas investigaciones. Entonces aquí pueden ver que la mayoría de los artículos se enfocaron en la epidemiología, que la mayoría de esos se enfocaron en los impactos que viene siendo, pues, qué impacto tiene el abuso sexual infantil en la vida de una persona. You can see here that the majority of our of the articles that were included focused on epidemiology. The majority of those articles focus on the impacts that child sexual abuse has on someone's life. El grupo después de ese son las intervenciones y tienen por la mitad pues intervenciones de prevención y intervenciones de respuesta. The second biggest group was on interventions, and so it was kind of half and half between prevention and response. Como ya había dicho, también hice un análisis de dónde salían estas investigaciones y la mayoría salió de África subsahariana. De África subsahariana, la mayoría de los artículos salieron de Sudáfrica. El segundo grupo más grande salió del Oriente Medio y África del Norte, que la mayoría de los artículos salían de Turquía. En todas las regiones, la mayoría se enfocaban en epidemiología. Solamente en Europa y Asia Central, ya sé que nomás son 6, pero la mitad de esos fueron intervenciones de respuesta. So you can see here that I did an analysis, right, of the regions where these investigations were coming from. The majority, as you can see, came from Sub-Saharan Africa, and from that region, the majority of the articles came from South Africa. The second biggest group was from the Middle East and North Africa, with the highest number of articles coming from Turkey. All of the regions that are included here put out mostly epidemiology articles, but except for Europe and Central Asia, although it's only 6, half of those were focused on response interventions. Aquí nomás les quise enseñar pues la diferencia de dónde salían los artículos. Turquía se ve que tiene 49 y Sudáfrica 38 y todos los demás pues mucho menos. Los países que no incluía ahí pues tenían 1 o 2. I just wanted to show everyone what countries had the highest numbers and how many articles they were putting out. So Turkey and South Africa, you can see 49 and 38, and all the other countries had a lot less. The countries that I didn't include here have 1 or 2. Okay, unos puntos claves. Para no usar mucho tiempo, puedo hablar más de artículos en específico si les interesa ya después en el panel de preguntas, pero a SBRI le interesa mucho las investigaciones que trabajan con una perspectiva feminista, que nuestra organización es feminista y trabaja con una perspectiva feminista. Entonces nos interesaba ver cuántos artículos salían de esta revisión del alcance, y en verdad pues nomás salió 1 de los 197. También nos interesaba mucho ver cuántos artículos salieron que incluían poblaciones interseccionales. Sí salieron más en comparación a la perspectiva feminista, se ve pues salieron 25, pero de todos modos siento pues que necesitamos más. Lo que de veras necesitamos más investigación es en comunidades LGBTQ, y también sentí que necesitábamos más intervenciones en familia, ya que la mayoría de los artículos de epidemiología hablaban y sabían de que el perpetrador era hombre y alguien que estaba en la familia o cercana de la familia. entonces se me hizo interesante pues que tantos artículos ya estaban hablando de eso y lo hablaban como hecho, pero no habían tantas intervenciones trabajando de eso en las familias. So some key points that I found and that we were looking for, SVRI works through a feminist perspective. So this was really important for us. We were interested in seeing how many articles, studies came out that worked through a feminist perspective. Unfortunately, we only found one out of the 197. And I did say that if anyone is interested in hearing a little more specifically on specific articles, or I'm happy to do so in the question and answer part of our event today, just so that I don't take up too much time today. And then moving on, we were also interested in populations, intersectional populations. So they included individuals living with HIV, orphans, or also known as street children, children with disabilities. They also had one article on feminized men. However, although there were 25 articles that came out, and in comparison to the feminist perspective, it is a lot more. I did feel that we were missing more articles on the LGBT community, as well as interventions on family. I mentioned in Spanish that since most articles were focused on the epidemiological side, they did mention a lot that it was known that perpetrators are men, are in the family or close to the family, but it was interesting to see that there weren't really many interventions working with families to prevent this or mitigate this. Entonces, para concluir, es evidente que necesitamos más investigaciones sobre este tema, ya que nomás salieron 197 estudios. Estamos muy emocionados de escuchar de los panelistas a continuación, ya que ya están haciendo este trabajo, y me imagino que también van a hablar de algunas brechas que han encontrado dentro de sus propias comunidades. Como ya sabemos, abuso sexual infantil prevalece en todo el mundo y debemos asegurar de usar los datos de los artículos de epidemiología para poder crear teorías de cambio para intervenciones de prevención y de respuesta, ya que la mayoría de los artículos de epidemiología fueron enfocados en el impacto. Esperamos también escuchar de ustedes y de las partes interesadas sobre cómo podemos aumentar nuestras actividades de creación de evidencia en los países de ingresos bajos y medianos, ya que ese es un meta o una parte grande de SVRI. So it is evident that, these are some concluding comments. It's evident that we need more research in this field. We only saw 197 studies. We are really excited to hear from the panelists today because they are already doing this great work, and I'm sure that they will talk about some gaps that they've also found within their communities. We know that child sexual abuse is prevalent throughout the world, so it's really important to utilize the epidemiological information to create theories of change for prevention interventions and response interventions, knowing that the majority of the articles that we saw were based on impact. And just one last thing, we are excited to also hear from you all, our stakeholders, to help us create new activities for evidence creation in low and middle income countries. This is a big part as SVRI, and it's a goal that we have. So we're really excited to hear from you all. And that's it for me today. I look forward to y'all's questions. Es todo de mí ahora y espero sus preguntas y sus comentarios.
Thank you so, so much, Nicole. And thank you so very much for being so incredibly flexible and agreeing to present in 2 languages. I know that must have been hard, and I apologize for that. We are going to be taking questions for all of the panelists after all 4 of them have spoken. So just to bring that up, I'm going to quickly hand over to Mariana now. Mariana, I'm sorry, but we have the same burden to
It's
place
okay,
upon
Aisha.
you, where you will have to give your presentation in 2 languages. And Mariana is going to speak to us about comprehensive sexuality education and the links between this and reducing intimate partner violence amongst young people in Mexico City. So over to you, Mariana. We're really interested to hear what you have to say.
Okay, just for the attendees, they have asked for the presentation in English, so we'll make sure to translate the slides for you also. Yeah, it's always very nice to present in our own language, so thank you very much. So I'll do the effort to be translating almost simultaneously. So here we go. So yeah, so as Ayesha just mentioned, I want to talk a little bit about the qualitative study. I'm sorry, I'm presenting in English. Voy a hablar del estudio de una investigación cualitativa que hicimos en México para medir cómo la educación integral en sexualidad juega un rol clave en la prevención de la violencia íntima o en el noviazgo de jóvenes en la Ciudad de México. So I'm going to talk about the role that CSC plays in preventing gender intimate partner violence in Mexico City. As you can see, like even the title has like very specific details of what is our target audience, like what is the analysis that we are doing and how important it is to us to give examples and gather evidence on how CSC can prevent violence. Entonces, como les comentábamos, en realidad es el título por sí mismo lo dice, es una investigación bastante bien delimitada, muy enfocada a jóvenes y a parejas que viven en la Ciudad de México, y lo que queremos hacer era recopilar evidencia para dar cuenta de cómo la educación integral en sexualidad puede prevenir la violencia íntima de parejas. Bueno, esto son datos de México. México es considerado uno de los países más violentos del mundo para las mujeres. 2 de cada 3 mujeres han experimentado violencia de género. So 3 out of 3 women have experienced violence, gender violence. And as I was mentioning in the previous bullet point, so Mexico is considered one of the most violent countries for women in the world, which is like really alarming, and it's something to start to be paying attention consistently. La violencia sexual es una de las expresiones más comunes de la violencia de género. So sexual violence is one of the gender type of violence that is more common in Mexico. La tendencia va en aumento. So as you know, like the pandemic has demonstrated to us that this is rising consistently, and yeah, that this has to be like somehow be a priority for our government. Well, I'm Mexican, so for our government and for all the governments in the world. Según cifras del gobierno, en 2020 se registraron más de 2 feminicidios por día en promedio. So according to the government, last year in 2020, 2 feminicides were registered per day in Mexico. So that's huge. 1 de cada 10 feminicidios le sucede a mujeres menores de 17 años. That means that 1 out of 10 feminicides are like women younger than 17 are victims of that. So what was the objective of our research study? So the first thing was there were many objectives. Of course, there was one research objective, which was to explore how CSC could contribute to prevent intimate partner violence among students ages 14 to 17 in Mexico City. Entonces, el objetivo de la investigación era justamente explorar cómo la educación integral en sexualidad podía contribuir a la reducción o a la prevención de la violencia en el noviazgo entre estudiantes de 14 a 17 años en la Ciudad de México. Esta fue una colaboración, bueno, fue una investigación llevada a cabo por la London School of Hygiene and Tropical Medicine en colaboración, un proceso liderado por IPPF-RHO y MEXFAM, que es la asociación miembro de IPPF Global. So this, and with the support, of course, of SBRI. So this was a collaboration between these organizations that you can see on the screen. MEXFAM, who is a member association of IPPF. So the idea first was to respond to this question. So how a CSE program or a CSE curriculum, and specifically the CSE curriculum of MEXFAM, contributes to the prevention of violence. Entonces la pregunta clave acá era explicar cómo el programa de ACE, de Educación Integral en Sexualidad de MEXFAM, podía contribuir a la prevención de la violencia. Y aquí identificamos muchísimas cosas. La verdad que MEXFAM siempre se ha caracterizado por ser una organización muy fuerte y muy sólida para la provisión de educación integral en sexualidad, tanto en contextos formales de la educación como en contextos no formales, es decir, en espacios comunitarios y en espacios más allá del aula, ¿no? Pero vamos a mencionar 4 que rescatamos como temas prioritarios que fueron que comunican y brindan mucha información sobre relaciones, sexualidad y tipos de violencia, identifican medidas preventivas y de protección relacionadas con la violencia. Es algo que además no solo se muestra conceptualmente, sino también hay como muchas referencias a servicios y a consejería, lo cual es un modelo integral bastante sólido. Permite que accedan a servicios de salud sexual y reproductiva, así como a consejería sobre violencia de género, y permite que haya un cambio de actitudes y conductas respecto al género y la sexualidad a lo largo del tiempo. So, what did we discover? What did we find out about MEXFAM's CSE? Curriculum. First, that they are really, really strong in communicating about relationships, sexuality, and types of violence. They also help you identify preventive and protective measures related to violence. They refer young adolescents and young people to sexual and reproductive health services. And most importantly, they refer them to youth-friendly services, which is like a very outstanding characteristic of MEXFAM services, provision of services. And also they help you to change attitudes and behaviors throughout the time. And that was something that was revealed thanks to the research. ¿Cuál era el formato de las sesiones de ACE? Bueno, obviamente se abordaban diferentes temas que eran parte de su contenido curricular, como el abordaje de la sexualidad, las infecciones de transmisión sexual, embarazos y reproducción, en fin, una gama de temas bastante completo. Y el tema del género se ve en todas las temáticas como un eje transversal. Es un tema prioritario y siempre se aborda siempre se aborda cuando se trata cualquiera de estos temas. Siempre se abordan los temas desde un enfoque género transformador. Hay múltiples técnicas participativas que incluyen la autorreflexión y la discusión en grupo, que es muy bueno. Provista por educadores y facilitadores formados del equipo de gente joven de MEXFAM, que es como el grupo de jóvenes voluntarios, jóvenes facilitadores que ellos forman también a lo largo de este proceso, y son 20 horas de sesiones semanales a grupos de 20 jóvenes entre 14 y 17 años. So I'm going to explain you a little bit the format of the CSE sessions. So all the topics that are addressed within the CSE curriculum have to consider gender equality and gender as a cross-cutting issue. So no matter what topic you decide to address, for example, sexually transmitted infections, there will be always like an analysis from a gender perspective, which is something that is outstanding again about MEXFAM curriculum. Also, all the topics are addressed from a gender transformative approach, they count on several participatory techniques that include self-reflection and working groups. So they allow them to have discussion among young adolescents and young people. And also all these trainings are provided by educators and facilitators that are trained by MEXFAM and that are part of their volunteer and youth network that is called Gente Joven, Youth People, and that has become like a really strong model of volunteers and facilitators within the organization. And then the structure of the session. So the idea throughout this research study was to provide and to analyze how this was impacting, how CSE was impacting in transforming attitudes and behaviors towards gender inequalities, to the prevention of gender violence through 20 hours that were carried out in different weeks, and 2 groups of 20 people between 14 to 17 years. So that was the target audience. And then, bueno, esta es una foto. This is a picture of one of the sessions, of the group sessions. Entonces, ¿qué queríamos hacer? Bueno, acá estamos ya investigando, ya se estaba investigando en el proceso el impacto de los programas de ACES, ¿no? Entonces fue un estudio longitudinal cuasi experimental con componentes tanto cualitativos como cuantitativos. Participaron en el estudio de 240 estudiantes de la Ciudad de México y los métodos de recolección de datos incluyeron la observación, las encuestas, las entrevistas y los grupos de control con docentes y facilitadores. So, what was the research study about? So, we applied a longitudinal quasi-experimental process, study, and with components both qualitative and quantitative. So within the research group, we counted with the support, and we counted with 240 young people from Mexico City. And the methods to gather information included observation, surveys, interviews, like in-depth interviews, and also control groups with teachers and facilitators, who are basically the people that provide the program. So what did we find out? First, we found, sorry, I'm switching into Spanish. So, los logros del programa de ACE fueron que se logró una reflexión crítica de parte de los estudiantes. Esto es muy interesante porque cuando uno analiza los resultados de los pre-test, te das cuenta que había como una necesidad tangible de información, pero ellos no le daban nombre. O sea, ellos sabían que había algo allá afuera que no estaban entendiendo, pero ellos no le podían dar nombre. Entonces, a lo largo del proceso se pudo identificar cuáles eran las necesidades reales de los jóvenes, de las y les jóvenes, y cómo un programa de ACE podía contribuir a llenar esos vacíos de información. Entonces, de manera muy general, los logros del programa fueron justamente que se permitió una reflexión crítica en torno a diferentes temas de parte de los jóvenes, que empezó a haber comunicación asertiva, o sea, ya no había tanto temor, tampoco tanta como agresión a la hora o frustración a la hora de comunicar alguna necesidad, que fomentó conductas de cuidado y autocuidado, que eso es también algo muy interesante porque uno asumiría que es como lo más común y normal, y no, esto significa que hay como problemas sociales, estructurales un poco de mayor peso, y también se identificó la necesidad de contar con docentes o con educadores y facilitadores formados. Entonces, what did we find out about the success of the CSE program of MEXFAM? First, that it actually allowed to have a more critical reflection around these topics, like CSE in general, but more specifically about gender equality and the prevention of gender violence. Then assertive communication was the other finding. And what does this mean? So at the beginning, what we were observing is that they were really, it was really hard for them to communicate. Like they could identify that they needed information about some topics or about violence because they didn't really understand that something that is violence was considered violence. So they were like, they lacked that type of information, and that was something that they wanted to learn more about, but they didn't know how to ask. So that's very interesting. So the assertive communication was one of the other findings. Also, the program allowed like a greater awareness about self-care and like care for others and self-care. And also, it also gave us the opportunity to identify that there is a need on training for teachers, facilitators, and peer educators. Like, we need to train them not only in concepts and methodologies within the classrooms or in communitarian spaces, but also to manage groups, because sometimes it gets a bit complicated to participate with young people. This is another picture, just to share some pictures. And this is something that we really liked about the research study, that, you know, it gave us evidence for advocacy. So in Spanish es muy lindo el nombre porque es como evidencia para la incidencia. De hecho, rima, ¿no? Y lo que nos interesa acá es empezar a recopilar evidencia para empezar a generar como algún mecanismo un poquito más ordenado y más sistematizado que nos abra un camino en espacios de política pública y de incidencia. Entonces, creo que este estudio, y bueno, o sea, no lo creo, lo que nos ha demostrado este estudio y esta investigación es que se volvió el contenido y los hallazgos de la investigación se volvieron información sumamente valiosa para ocupar espacios de incidencia y de política pública, no solamente en México, pero en América Latina. Entonces, esto es algo muy interesante. Muy rápido, la evidencia nos muestra que la educación integral en sexualidad debe garantizarse en los ámbitos educativos, tanto formales como no formales, de manera que se fomenten las relaciones equitativas entre adolescentes, que debemos de incluir técnicas pedagógicas y actividades participativas, ¿no? No solamente llegar y decir, bueno, la violencia es mala, no, o sea, como explicar por qué y darles razones también para que ellos en su cotidianidad las apliquen. Y el tema de la importancia de referenciar a los jóvenes a servicios de salud sexual y reproductiva. So very briefly, just to what this evidence, what this research study gave us as evidence was to help us understand how important it's to guarantee CSE within formal and non-formal educational settings. Also to include like pedagogical techniques and activities and more participatory activities that include adolescents and young people. And very importantly, to refer young people to SRH services. And some of the last recommendations is that CSE should be scaled up. CSE should include all types of violence, address them, and like really help young people to understand like the causes and the consequences of it. That CSE should seek to prevent gender-based violence and also incorporate a gender transformative approach. And that research studies of this type have to be adapted to the different context in our region. So, las recomendaciones es que la educación integral en sexualidad debería de escalarse, ¿no? Y que debe ser inclusiva y de calidad, que debe abordar todos los tipos de violencia que existen y entender como las causas y las consecuencias de esta. Que debe de prevenir también la violencia basada en género y tratar de incorporar un enfoque género transformador, y que la investigación sobre este tipo de intervenciones, sobre todo por la complejidad que tienen que siempre adaptarse a los contextos específicos, ¿no? Aunque en América Latina todos hablemos español, no, o sea, todos tenemos particularidades ¿no? muy específicas que no pueden hacernos como transferir, sí algunas buenas prácticas y algunos modelos, pero no toda la integralidad de la investigación. So, nada más muy brevemente, en el equipo de investigación participaron Shelley McLeod del London School, Yvonne Silva de MEXFAM, ellas fueron como nuestras líderes principales del proyecto, y desde la organización que yo estoy representando, que es el International Planned Parenthood Federation Western Hemisphere Region, estuvimos Susana Medina y yo, Mariana Cruz. Muchas gracias. Thank you very much. That was the research team, just in case you missed it.
Thank you very, very much, Mariana. We really appreciate that. And as I said, all the extra work that went into doing it in 2 languages. I really appreciate it.
Oof, it's okay.
I'm sorry.
It's
We
okay.
have to send you a gift.
No.
Thank you. So we will move on now. Just I'll give a very brief pause to say that a message has come through saying that there's a potential that with English as the base language, which is the next 2 presentations, you all might be able to use this translation service. So if anyone wants to, if they're looking, I saw that there were some people needing translation into Romanian or any other language, and they would like to try again. It might be worth another try. Again, just click on the view stream on custom live streaming service and a window will open for you in which you can test your language, select your language. So it might be worth another try, even though it has been a very frustrating exercise so far. All right, without any further ado, I'm going to move on. I'm going to hand this over to Adesti Dulawan, who is going to speak to us about research and response to online sexual exploitation of children amidst COVID-19 in the Philippines.
Thank you so much, Aisha, and good afternoon to everyone. Thank you for being with us today. So I am Adesti Dulawan. I'm serving as the clinical supervisor of World Hope International. So over the course of the recent years, child sexual abuse has also evolved, and one of the newest forms of which is online sexual exploitation of children. And I'll be discussing this in the context of the Philippines. When we say online sexual exploitation of children, or OSEC, it is an emerging form of exploitation and child sexual abuse that happens in information and technology platforms. It usually involves production, possession, and distribution of child sexual abuse materials and the gradual grooming of target victims, purposely for live streaming of sexual abuse or exploitation. Unfortunately, among all the lower to middle income countries, the Philippines has been severely impacted by this form of child trafficking. The Philippines was actually found to be the global epicenter of live streamed sexual abuse in 2016 by UNICEF. The figures had been really staggering. According to the National Center for Missing and Exploited Children Cyber Tipline, the estimated number in 2014 has been about 23,000, and it rose very sharply to about 81,000 in 2017, and it's been increasing rapidly ever since. So that's about 250% increase. There are a lot of features of OSEC that are very disturbing. And in the recent prevalence study, it was found that the median age is only 11 years old, and we have as young as 1-year-old survivor who we are catering to in our partner residential facilities. Another heartbreaking fact about this form of human trafficking is that 41% of the victims of abuse was facilitated by their very own parents or biological parents, and 42% by other relatives. So that accounts for about 83% of abuse facilitated by people related to the victims. So the abuse and exploitation varies. So the children are usually made to do, sexual performance shows online. And it was found that usually the customers tended to be from Western countries, although some of them also lived in the Philippines, or at least traveled in the Philippines at some point in time. The figures are already high, and then comes in the pandemic, which caused a lot of disruption in the lives of people globally. And an effect of which, of course, is the economic downturn because of the loss of livelihood, the loss of jobs among people. So the impoverished families even became more vulnerable. In the findings of the Department of Justice here in the Philippines Cybercrime Unit, the figures from the pre-pandemic has increased to about 264%. So the reports that they have been receiving previously before pandemic in 2019, that year, the average was about 76,000. And then starting in 2020, when the lockdowns were enforced, it rose to about 279,000. Because of this social problem, the World Hope International, along with the University of Southern Philippines Foundation, proposed a research and aftercare program to the SVRI, which we are very grateful for having been granted. Specifically, we called it Research and Response to Online Sexual Exploitation of Children amidst COVID-19 in the Philippines, because we felt like there's lots of gaps. There are lots of puzzle pieces that still need to be uncovered about OSEC. And one of the gaps that we are encountering is that there's really no actual prevalence of OSEC. And that's mainly because it remains to be known because for one, it's of course it's happening online. And so there's encryption, there's anonymity. So it's really difficult to ascertain a concrete number of as to how many children are actually really being victimized. Another is that there is perpetuity of abuse in OSEC. Right now, as we are speaking, the physical records of sexual exploitation are still in the internet. Thus, the children are still perpetually being abused every single time a person is watching that. And also the driving factors among families, especially at this time of COVID pandemic, also needs to be established. Another thing is that OSEC is a distinct form of sexual exploitation. It cannot be approached with the same strategies as the usual form of child sexual abuse because the victimization experience is different. It being technology facilitated, it's family facilitated as well. So all of those make the victimization experience unique. Thus, it's important to know how do those collectively impact the mental health of survivors. And then, of course, again, therapeutic intervention should also be tailored fit to the unique victimization experience of the survivors. And so with this in mind, we narrowed it down to investigating the following problems. We wanted to look into the mental health profile of OSEC survivors, especially those rescued during the pandemic, in the domains of trauma, internalizing, and externalizing symptoms. We will also be looking into the efficacy of various modalities of therapeutic interventions in the reduction of trauma symptoms and problem behaviors. Because in the program component of the project, we are doing capacity building programs for social workers, for psychologists, for counselors who are providing interventions. So we are training them on various therapeutic modalities, and we are looking into the efficacy of those. And then we will also be looking into the lived experiences of care providers in residential settings, handling the OSEC survivors during the lockdown, to collaborate the scores that will be assessed from the mental health assessment. And then, of course, we wanted to look in-depthly on the family dynamics. What is it that's with these families? And of course, the driving factors among them that drove them to engage in OSEC activities during the pandemic. So we will be employing a mixed method design. So we will be using psychological tests to check on the well-being of the survivors in terms of their trauma and problem behaviors. We will be corroborating this with in-depth interviews. So in terms of participants, we will be having 70 OSEC survivors who were rescued during the pandemic. We will be doing interviews with 10 social workers and 10 non-perpetrating family members to establish triangulation of the data. In the course of doing this study, which we started in June, just this June up until 24 months, there are challenges along the way. And now that we are about to jumpstart, there are already challenges that we are facing. And one of which is the tedious ethical clearance process, which is of course understandable because the participants involved are children, and not just children, but are vulnerable children. So we are looking into getting ethical approval both from institutional review boards and from the Department of Social Welfare. Another practical problem that we are facing at the moment is access to the survivors because of course, the health risk that is prevailing. And then there's always a risk of re-traumatization during data gathering, be it during testing or during interviews. Another also is that the survivors are very protective of their families, which may limit the information that they are able to share. And then we are also dealing with grooming effects, whereby the survivors and their families usually have distorted views about abuse. And usually OSEC is perceived to not be a form of abuse. So yeah, we are dealing with those during interviews. And then of course, it's anticipated that there's going to be a high level of clinical disturbances among survivors. So what we are doing to mitigate this is employing ethical and therapeutic strategies. And we are doing so by linking the research to case management for survivors and families. That we are not just collecting data, but rather we are using this data to drive forward the healing, the restoration of the families, because we are working together with the case management team. And of course, practically, we need to have health protocols in place. And then we are looking into virtual data collection. And then we are also doing comprehensive orientation on the research project to the management of these child caring agencies who are providing shelter to the survivors, and of course to the survivors themselves and to their families, because it's really very important that they understand the entire process of the research, what it aims to do, and how it's going to benefit them essentially. And then intensive training for the research team on trauma-informed care, ethical guidelines, crisis intervention, assessment protocols, just to make sure that they have the needed knowledge and skills, competence in being able to do the research. And of course, it's monitored by psychologists. We're making sure that there are trauma-informed care in place, and of course, highest adherence to ethical practices during the entire research process. And lastly, we are working with a team of clinicians. So they will be the ones who will be attending to the clinical disturbances, should there be, that will be found during assessment, so that the children will be attended to after assessment. Now, moving forward, so much still needs to be done further to improve survivor care and prevent proliferation of online sexual abuse. One is to continuously study all the facets of this new form of abuse to have a really complete picture of what OSEC is, its dynamics, its impact. Another is tying findings to applied science, such as evidence-based interventions that will actually guide the treatment of survivors. And finally, using data-driven findings to craft aftercare programs for restoration of the survivors and their families, and to guide the crafting of child protection laws. So through the research and aftercare programs that we are doing, we are trying to secure a healthy and safe future for the Filipino children. Thank you.
Thank you so much, Adesti, for that incredibly interesting presentation. All right. Okay, and now I would like to go to our last presenter, and absolutely not our least, Anil. I'd like to welcome you and ask you to please address us on online intimate partner violence against teens and young people in Nepal. And after this presentation, we're going to open the floor to questions. And as we're going on, if you have questions that you're posting in the question box for particular panelists, please do actually say which panelist you're addressing your questions to. Thank you so much. So Anil, over to you.
Okay. Thank you so much. May I start screen sharing of my presentation?
Absolutely.
Can you see the screen?
We can see the screen. You might want to put it on the slideshow. Yeah.
Yes.
That's great.
Okay.
Yeah, thank you.
Okay, so this is about our learning and experience as well as the challenges we are facing in Nepal in terms of the research studies on online sexual abuse and exploitation of children and young people. And as a grantee of SPRI research, we are conducting this research on online intimate partner violence against teens and young people in Nepal. So let me give you a background of how we started and what we do, and also about some of the experience we have in Nepal. So Child SafeNet is an organization dedicated to work in making the internet safer for children and young people. So our main areas of work are research, training, awareness raising, and advocacy. And about the background and relevance of this study, we have some information from the other sources as well as from our own research studies. Before, we conducted three main studies. That's one on online behavior and risk among children and young people, their habits and their awareness about the threats and risks and the support system. Then we conducted a study on live streaming of sexual abuse and exploitation of children and young people in Kathmandu Valley. Then we conducted a survey on impacts of COVID-19 on child sexual abuse online. Then now this is the new study we are conducting on online intimate partner violence against teens and young people in Nepal. So according to the latest data, the internet penetration has gone to 92% in Nepal. That's almost everyone who are able to use a smartphone or mobile phone or internet, they are using internet in Kathmandu or in other cities or even in the rural areas. And teens and young people are at a higher risk of online abuse and exploitation. And the borderline between online and offline has been blurred. So we no longer are calling this like protecting children online. We're talking about protecting children in the digital age. There could be children affected online or offline, or because of the continuum and interrelationship between online and offline. And the knowledge and awareness on online risks and internet safety among children is very low. And existing research studies on IPV in Nepal focus on the offline dimensions only. And now these some of the figures I'm giving are from our previous studies. Like 1 in 4 teens and young people use the internet more than 10 hours every day. That is after the pandemic, COVID pandemic, it's more than 10 hours per day. That's including for study and also for gaming and social media, YouTube. And 1 in 5 girls and 1 in 10 boys, teens and young people, they experience sexual abuse online. And 14% of teens and young people, they experience live streaming of sexual exploitation. And the methodology for this study we have designed is a mixed method, and we conducted literature review, although the literature on online component of intimate partner violence is very difficult to find, but we managed to get some information mostly from other online child sexual abuse research studies and documents, as well as from the offline intimate partner violence studies and documents. And then the other tools we'll be using are online and offline surveys. We plan to do 5,000 quantitative data collection, 4,000 using the online tools for young people aged between 18 to 24 years, and 1,000 with the teenage children is between 16 to 17, because we also need the parental consent. So that's why we are planning to make offline surveys for younger respondents. And the focus group discussions will be 40, and key informant interviews will be 100, and artificial intelligence tools is also being developed. And for the research sites, we are planning to conduct research in 10 districts from all 7 provinces of Nepal. And the study population, as I mentioned, are teenage children between 16 to 17 years, and young people aged between 18 to 24 years. This is because of the issue. It's not only about the abuse and exploitation, it's about the abuse and exploitation and the violence by the intimate partners. That's why the age is slightly higher than other studies we have conducted before. And the priorities, the objectives of this study is to understand the prevalence, patterns, and the emerging trends, as well as vulnerabilities and attitude of teens and young people in Nepal on the IPV using the digital technology. So we don't know the magnitude, we don't know how it's happening, or actually people, there are some anecdotal information we got and some reports, but we don't have much information about the magnitude or the trend or the vulnerability. So we plan to collect such information and also to identify the risks, factors, and the coping mechanisms. Then also to designing the specification and language processing for building the artificial intelligence model to define algorithms, data requirements, scope, and limitations, and also to develop a set of policy recommendations addressing online IPV in Nepal. So as we don't have sufficient evidence and also the information required to advocate for policy implementation, so we need to do something to use from this research as the outcome for making appropriate policy, and also to make the government and all the stakeholders responsible to work on this. And the barriers to conduct this study, actually not only for this one, for other studies as well, is like we don't have much literature, not only on online IPV, but also on other forms of online child sexual abuse. So for online IPV, actually, we didn't find a single research or any useful information in Nepal. There's some information we receive from other countries and some on offline IPV, but not on online IPV in Nepal. And data sets for the artificial intelligence is quite complicated because of the data sets are not available. It was not done before in Nepal, and also the complexity of using Devanagari, our the font used for our language, and also people use Roman characters and also use of slangs. It's a bit quite complicated to use the AI tool, but we are working on this. And the ethical clearance is another obstacle we are facing, because Nepal Health Research Council is the only entity in Nepal that provide the ethical clearance, but they are not specialized, or they don't have specialized people on social studies and particularly on child sexual abuse and exploitation. So, and also it's quite bureaucratic and time consuming. So we are having difficulty with ethical clearance as well. And for the respondents, as Adesti mentioned, for our previous studies and for this study also, we are having difficulty in identifying and reaching the respondents who experience sexual abuse and exploitation, including online intimate partner violence. So first to identify and also to reach them, and also to make them available for the interviews and for the research. And the truthful responses, although we had in the past reached those people who experience sexual abuse and exploitation. They are not open to speak, and because of fear of stigma and shame, they might not provide truthful responses and deny that it happened to them. So that is another barrier, and we need to address that. And we have some ideas to address those barriers and obstacles, and some we have done in our previous research studies as well. And for the literature review, I mentioned that we are using offline IPV and online child sexual abuse, and also from Nepal and other countries, we're doing literature review. And also for the data sets for artificial intelligence, we are curating data set available online for AI tool. These provide preliminary samples, but these are not sufficient. And for the ethical clearance, we have approached the Nepal Health Research Council, and we are preparing documents required for submission. And also we are getting your advice on how we can expedite the ethical clearance process. And for the respondents, we are getting help, and we are planning to mobilize our field researchers to identify and approach respondents, and including those who experience online IPV. In this case, for other, we use child sexual abuse online. And for the truthful responses, from our experience and learning, what we did was we conducted brief sessions on the issue of child sexual abuse to the potential respondents before collecting data, and also to get support from the parents for their consent and all those things. We have made notes for the parents and for the schools. And we conducted research studies in the places where respondents feel more comfortable and more, they have no problem in expressing what they experience, and also in absence of other people, including their family members or friends. And also for the quantitative data collection, we use self-administered questionnaire, printed questionnaire. And also now we'll be also using, actually we used before also the online version of the survey questionnaire, which can be filled without other people looking at the questionnaire. So in the, actually in the schools and colleges, in the classroom settings, what we do is we place the respondents far, actually about 2 to 3 feet away from each other. So they are not looking at other people's papers, and they are not talking to each other, but we make them comfortable and give them all the information about filling the questionnaire. And then in that way, we got more truthful responses. So it was actually, we got this type of lesson learned from our research on live streaming of sexual abuse and exploitation. And the key learnings, like we need to involve multi-stakeholder organizations and experts. They can generate support and knowledge base for resources on child sexual abuse. And also do no harm, data privacy and consent of respondents are very important. And we need to train everyone involved in the research in terms of their, like not to re-victimize the respondents, and also to not to judge them, and also to use the politically correct language, and also to make them feel comfortable. And research studies need to be linked with actions to develop linkages between knowledge and actions, not only as the academic research. So that's why for this research as well, we have planned research uptake. And after the research, we will be using the findings of research for more actions. And research uptake needs to be planned and implemented carefully. That we have made some plan, but depending on the outcome of the research, we may make some changes in the uptake as well. And artificial intelligence is still a relatively new field for social researches, particularly in Nepal. It has tremendous potential, but also it comes with risk if not implemented properly. Like if it's not implemented properly, the data sets and the outcome might be misleading, and we may not get the good response. So that's why it's very important that the data sets and our planning for artificial intelligence tool is done with pre-testing and also with all these planning done properly. And partnerships and collaborations between organizations within the country and internationally will help us to develop and transfer expertise on research studies related to sensitive issues. For this, we are constantly in touch with SBRI and other partners. So for any support we are in need, we request and we get, we consult. So that's why the international and national partnership and collaborations will be quite important. And that's how we will be conducting the research. And these are some of the key learnings. Thank you very much. That's all from my side. And if you have any questions, I'll be happy to answer. Thank you.
Thank you so much, Anil. Really appreciate that. All right, so we've got about 11 or 12 minutes left for questions, and I'm sorry, we had anticipated having slightly more, but of course we had to do more work with the translations and stuff, and so we've taken a bit more time. Thank you to all our panelists for extremely interesting presentations. We really appreciate it. There are one or two questions in the chat box and in the question and answer box, so I'm going to I'm going to read them out and just ask, the relevant panelist or anyone who would like to actually address it. So there's one question that says, thank you for the interesting and important presentation on the CSE and intervention and its role in addressing IPV among young people. Fascinating work. Was there any type of an intervention delivery process evaluation conducted to assess things like intervention delivery, fidelity, dose, and/or reach? And I think this question is for Mariana. And Mariana, would you like to address it?
Yes, thank you. Thank you, Ayesha. Yes, this is a very interesting question. So yes, actually one of the contributions of the research study, apart of like responding to the original hypothesis that we had and providing evidence on how important is CSE in preventing intimate partner violence, it actually helped us identify some challenges and how to address them. So for example, what we identified, and I think I mentioned it very briefly during my intervention, is that sometimes like facilitators and teachers are very well trained in concepts and methodologies, like pedagogical methodologies, but they are not very well trained in managing groups or like problems within adolescents when they start like lacking, like like disrespecting their peers, or like especially when it comes to addressing any sort of violence that has to do more with gender identity or sexual diversity, like they start playing or like or offending their other peers by saying like, well, why would you say this if you like men, like to a guy? They would say like these type of comments, and sometimes for some facilitators it was very hard to manage that type of situation. Like they could just like ask for respect and all of this, like as they would do at the beginning of a session, but it was kind of hard to manage those type of things. So what we started doing was to respond to that specific situation throughout the process of intervention and throughout the research study. And we developed, like with the support of MEXFAM team and with the support of the researchers, we started to develop like some strategies to respond to that. Also, well, that's, for example, when it comes to the delivery process. And then I don't really understand, Ayesha, probably you can help me, when it says those and or reach. You mean, I don't understand what that means, if it has to do with.
I also don't understand what dose means. I assume reach means how of the reach of the project, like in how many different places or how many different young people it reached? I would imagine that's what, Anik?
The dose probably refers to how much time was spent with the participants and over what period of time. So was it 12 weekly 1 hour sessions? So it's a 12-hour program, but it's delivered in 1 hour sessions over 12 weeks, for example.
Okay, yeah, great. Thank you, Anik. So it was, as we mentioned, it was quasi-longitudinal study, which means that we focused on specific target audience, like we were working with 240 young adolescents throughout a 3 years period. It's as usual, like we faced a lot of challenges. The first one is that when we were starting the research study, there was like a very dramatic earthquake in Mexico City, and it affected the intervention. Actually, it was like something completely external to our process. But we made sure that when we started the research study again, that we were working with the same group of people. And here it's important to mention that we could identify like consistent responses, partially consistent responses, and inconsistent responses. And there is an analysis about how the respondents, and as I think all the researchers here were mentioning, we were using mixed methods to analyze the information. So it was a pre and post survey, it was in-depth interviews and case studies, which were actually really good. And what we learned from the case studies, for example, is that actually it strengthened the relationship between the facilitators, the researchers, and the target audience. And yeah, I mean, there are so many details about the study, and I think that's why it's so interesting and exciting, because it was like it responded to our main objective, but we learned so many things about the process, and also because it was like a 3 years process. So yeah, I hope that responds, but if not, like we can exchange some like more information by email, or like provide some of the tools and the responses and all of this.
Thank you so much, Mariana. So we have 5 minutes left, and we might go a tiny bit over, and we understand if people need to drop off. We'll try and deal with these next couple of questions. There's a question, and I think, Nicole, this refers to your presentation. Can you speak about the scope and any reflection on research on detection or early warning to prevent child sexual abuse from the studies surveyed? Did anything like that come up for you that you want to mention?
Sure. So in terms of the scope, the only limitations that we had were the ones that I included in the exclusion criteria. And so it was pretty much anything that dealt with child sexual abuse and it disaggregated the data, it was included in this study or in the scoping review. In terms of research regarding detection or early warning to prevent child sexual abuse, off the top of my head, I remembered some methodological ones that talked about reporting. There were a lot of case studies that came out throughout the scoping review, and so those were just like either one or a few cases that they looked at, and it was constantly talking about how they almost ruled out child sexual abuse. So there was a specific article that comes to mind that highlighted how child sexual abuse should never be ruled out, regardless of the reason why the child is brought into the hospital. And then lastly, there was a study looking at the perceived skill and preparedness of pediatricians in Serbia and in Montenegro. So what that study looked at was just asking them, how prepared do you feel to diagnose and assess child sexual abuse? 1/3 of the pediatricians that were interviewed said that they were prepared, and as well as 1/3 said that they would take on some more training on diagnosing and assessing child sexual abuse. So that was definitely something that was interesting, considering that they didn't feel that they were super prepared to diagnose and assess, but they weren't very motivated to get additional training so that they could assess and diagnose.
Thank you. Thanks very much, Nicole. And another question directed, Adesti, at you is, thank you for this extremely important work, especially in the time of COVID. I believe you said in your project that virtual interviews were conducted, and can you provide some additional information on strategies that were used to build rapport with CSA survivors to talk about such a sensitive topic in the virtual interview environment, as well as the strategies for providing support and referral in the virtual environment? And Adesti, would you like to comment on this? And Anil, after that, if you feel like commenting on this as well. I know this is an obstacle that you faced with your work as well. So over to Adesti.
Thank you so much. So my apologies, I think I wasn't able to expound on this. So for the data gathering, we won't be doing virtual formats for the survivors themselves, because that is really very that's really very challenging, especially that the kind of abuse that they went through happened online. So even just, like putting on laptops in front of them can actually be trauma triggering. So the virtual data gathering that I was referring to a while back would be for the interviews with the social worker or with the house parents, because either way, we need to move along with data collections. So what we had in mind would be, we will do first the interviews, and then when the surge, because we are at a very high rate at the moment, when the surge goes down, then we will be dealing with the children in person, because that's really very true. It's important. It's really important to do it in person as much as possible, because again, the trauma that they went through, plus of course, in the initial findings of the studies that were conducted on OSEC survivors, one of the predominant characteristics is the feelings of shame, and then they are usually suspicious and are very mistrustful. And so establishing rapport in a virtual format is really very difficult. And so we're on the top of our head, we really won't be doing that as much as possible, and we're really hoping that the COVID situation will improve. So in person later on, what we had in mind, which we trained already our field data gatherers on, is to have sets of rapport building activities such as casual introductions, plays, games, drawings, play activities, among others, that they can start on in establishing rapport with the child and not directly administering the psychological test. And then we will make sure that there is a person who the child is familiar with, such as, of course, the social worker within the premises of the venue during data gathering, to ensure that the child feels safe. And then we really emphasized among our researchers that they really have to prioritize establishing rapport first with all the strategies that we were able to train them on before doing before gathering the data. So if that will need to take time, like if it will need about 2-3 visits, 4 visits, then there's no way for us to rush that, because we really need to establish a good therapeutic alliance first with, or at least rapport with the child, before moving forward with collecting data from them. And then, as I mentioned a while ago, any clinical disturbances that will be found either during observations or during, of course, the scores in the test that they will be administered with, they will be referred to our team of clinicians. These are child psychologists and child psychiatrists who are part of the team of consultants who we will be referring the children to should there be clinical disturbances uncovered during the data gathering. So yeah, I hope that answers your question.
Great, thank you, Adesti. And Anil, I'd like to just turn it over to you to see if you have any comment about this. And also there's another question that's come up about an obstacle that has come up for all of you around ethical clearances. And maybe if you want to briefly comment on that before we wrap the session up. You're on mute.
Actually, the problem is very similar what Adesti mentioned about reaching the respondents. And I think considering the issue is dormant and people don't want to talk about, I think the study on online IPV will be more challenging than what we did before on CSA, because here many people, they have also like when they are involved in intimate partner things and the violence, people don't want to say that they have that type of relationship. And in cases where they are exploited and abused, they may also feel that they are part of the process, like they did with the consent. I took my photo, gave my passport, and I was part of that. And so they feel guilt about that, and they don't want to talk. And also when we go to the parents or teachers for the consent, many people, they might, what we fear is they will say, my son, my daughter doesn't have any such intimate partnership relationship with anyone. So I will not allow my child to be interviewed. So that type of thing should be there. And the guilt, shame, and also the hidden nature of IPV might be a challenge. And for the to reach them, as we discussed, we will be using some other ways as well. Like we have a very big survey numbers, 5,000, and in the questionnaire we also have, like, it's a volunteer. We are not collecting personal information like name, address, email address, those things. For now, we are not collecting. But at the end, there will be a place, if knowingly, by consenting, if they want to talk about that, then we will contact them. So in that way, if out of 5,000, if we manage to get 20 or 30 people who are willing to talk, then that is also another way. And also then the value of talking to us and value of participating in the research should also be explained, that it might help them directly or to those people who are like them. And the thing, like some of them or many of them might be still undergoing violence during the research. So what shall our researchers do in that case? Like the psychosocial support, legal support, medical help, other things. We are not providing as the service provider, but we have a network of service providers, so we can reach them. We will contact them and inform that we'll liaise the child or the young person for service and support, and also maintaining all the protocols for maintaining your confidentiality and anonymity. All those things will be done. And so we'll liaise with them, and we will help them to get those type of support. And I think it will be quite interesting to conduct this research, and particularly with the involvement of artificial intelligence, then we can also get more data from that tool as well. Thank you.
Thank you. Thank you so much. Thank you again to all our panelists. I'm sad to have to draw this session to a close. It doesn't feel like there's been enough time, but I know that 95 minutes is a lot of time. And thank you all for being with us. Many of you have asked about availability of the presentations and the recording, and we will in due course make all of these resources available. And should you need more information, should you want more information, please feel free to contact us at SVRI. And yeah, I mean, from me, that's it. I'd like to just ask Anik to just also, I'm handing it over to you, Anik, to also say goodbye. And thank you everyone again. And especially to our Spanish speaking panelists. Thank you so much for being so flexible.
Yeah, thank you, everyone.
Thank you.
Big special thanks to our panelists and to everybody for your flexibility when Wordly did not work as we had anticipated and hoped in our experiment to have more diversity in the way we have our learning events. So thank you all for your patience and flexibility on that. I hope that you have all gained something from this very thought-provoking and important panel. again, on such a sensitive but such an important topic. So I wish everybody well and hope that you keep safe. Thank you, everyone. Bye-bye.
Thank you. Bye-bye.
Thank you. Bye-bye.
Thank you. Bye-bye.